Our next speaker is Deborah Ketch, an oncology nutritionist with Diablo Valley Oncology, and she's going to talk about nutrition and breast cancer.
Good morning, everybody. Thank you for being here, and it's an honor to be here in the presence of all of you. So I'd like to, with the information from Dr. Svan and from Kate, I'm just going to dovetail in the kind of nutrition aspect of people's treatment and survivorship and what we can do to try to prevent it, what you do while you're in treatment, and lots of those things. The general guidelines that we have kind of basically are just ways of living in your life as we are now and trying to prevent many, many different kinds of cancers, as well as just living a normal, good, healthy, balanced life with increasing, fruits and vegetables, decreasing fat. This is probably stuff you may already know, just kind of reiterating a lot of the stuff that's out there. We always want to decrease the fat and get an adequate amount of protein, especially if you're in treatment. It's a tough one. I end up talking to a lot of women of how to just basically get food in you and calories in you when you don't feel good and you don't want to eat, and how to boost those things. And I do a lot of that from that kind of perspective. And also minimizing any smoked foods, cured, pickled, that can be a little carcinogenic, as well as just maintaining exercise. And Tiffany had mentioned that about making sure you're doing your exercise, not only for just your general well-being of feeling healthier. It does raise normal endorphins in your body that help with serotonin. It increases your mood. It helps with endurance of getting through your treatment, and then later on for preventing recurrence of breast cancer as well. And alcohol, it's generally pretty well understood that 3 to 4 drinks a week is an acceptable amount for women. Not all of them at the same time, hopefully, on a weekend when you decide to binge. It's probably better that you sprinkle it out throughout the week, maybe one every other day. And some wonder which kind of alcohol. Is it hard alcohol? Is it red wine, white wine, kind of beer? I think it's generally the research really points to the antioxidants that are present in red wine as opposed to any other alcoholic beverage, but as long as it's not very much, it's probably better for recurrence that you don't drink very much at all. As well as fruits and vegetables. So I'm pretty passionate about nutrition. I do it on a regular basis in my practice with people, just from a perspective of cardiovascular health, nutrition, in a sense of cancer prevention, and just daily life. And these are actually most of the vegetables that are been shown to be cancer fighting, potential for cancer fighting. A lot of the cruciferous vegetables, broccoli, cauliflower, kale, lots of interesting ways to cook them. You don't have to eat them raw. You can find all kinds of recipes that are really make them quite tasty. Put them in smoothies, blend them, juice them, do whatever. There are lots of good ways to get the nutrients out of them, as well as eating whole grains. This is something that I deal with a lot, even with cancer patients who have diabetes, which is kind of a struggle sometimes, of not eating too many carbohydrates. What are the good carbohydrates? Basically, what we really try to strive for are the complex carbohydrates found in the high fiber food. So try to steer away from the white refined sugars and the white refined flours. We find that the ancient grains are much better as far as the phytochemicals that are present in them. More of the amaranth, spelt, quinoa, brown rice. These are just some examples. A nice pretty picture that Sarah put in there for me. And these couple tables here that you'll find kind of lists a lot of, so you just have something to take home. It's a lot to digest when you're here hearing a lot of this information from me and from the rest of us. So at least you have something to kind of go by on a regular basis of what actually has been shown in the studies to fight cancer, potential cancer-fighting materials in them for cancer prevention and recurrence. A lot of the studies point to these kinds of foods, as well as the grains And some people believe, and there have been some studies show that soy, does raise estrogen, so you have to be careful about that. So there are lots of different alternative milk products, if you will. There's, almond milk, coconut milk, rice milk, hemp milk, just about any kind of alternative milk product that you could find. It doesn't necessarily have to be soy milk, but just as if you vary it, it's a really good way to combat some of that. More of the cancer-fighting foods. These are big fancy words over here that just kind of, that the chemists like to throw in there. Am I going the right way? Yeah, okay, sorry. And we'll get to fat really quickly too. Fat, we all know, just for general purposes, most of the time it's better to have decreased at least less than 30% of the amount of fat in your diet. Of calories in your diet should be less than 30% of fat. So, because it does increase obesity, which does increase risk of any kind of cancers and breast cancer as well. But the good fats, we know, are things like avocado, olive oil, nuts. The kind of a Mediterranean kind of diet really has been shown to really decrease cancer prevention and cancer recurrence. More of the animal fats tend to increase it, right? Plus it increases adipose tissue and whatnot. So the good fats have been shown to and are really, really beneficial for this. And definitely the fish and fish oils. If you're going to eat meat, it's best to eat it less than one time a week, and substitute it with more like chicken, protein sources from this kind of thing. So lean meats, eggs are a great source of protein. Sometimes it's really hard to get protein in your diet when you don't really feel like eating. So there are ways to boost your protein intake by protein powders. There are egg white powders that you can add to your smoothies to help increase your caloric intake too. And sometimes people just don't feel like chewing much when they're dealing with nausea and whatnot. So they're, just having something to drink and sip on seems to be a little more soothing than actually putting a whole bolus of food in your stomach, which some people just don't tolerate that very well. So there are ways to kind of boost those calories. I'm not going to read this list. You have a copy of it. You can read it your own time too. And then we know that exercise does really benefit not only your mood, but your endurance for getting through the treatment and for cancer prevention or recurrence later on. As Dr. Swan mentioned as well, it's our boost to try to get you to exercise more. And even if when you don't feel right, on the weeks that you're not in treatment, those are the weeks that you should really try to push yourself. Walk, run, jog, swim, bike. There are lots of people who are going through unfortunately, the same thing. It's really good to try to get, your support groups that Julianne was mentioning. So it's really, really important to try to get at least 3 to 4 days a week of at least 2.5 hours total during the week of exercise. So basically, this is just kind of it in a nutshell. There is one other thing I wanted to mention. So refined sugars. So it's best that we know, just for generalized health, that we shouldn't really have many refined sugars. Anything prepackaged, anything that has more than 5 items on the label, we kind of wave by. That's kind of the rule of thumb that we practice in sort of the nutrition world. I'm a physician assistant as well. I do a lot of teaching even in my own practice with nutrition and oncology and in family practice. So it's really important that to become a good label reader. If you can't understand the food or the item that's in there, why do you want to put it in your body? It's not really beneficial for you. It's better to eat whole foods, things that you understand that you want to put in your body. Imagine everything that you eat and drink goes to every single cell in your body. And drinking fluid helps flush that through your kidneys. They need help getting rid of the chemotherapeutic agents. It's really important to keep yourself hydrated and nutritionally sound and doing exercise. It's a lot to digest all at once, but I'm happy to answer any questions that you have, and thank you very much.